Congestive cardiac failure. Heart failure, sometimes known as congestive cardiac failure, occurs when the heart muscle doesn't pump blood as well as it should. When this happens, blood often backs up and fluid can build up in the lungs, causing shortness of breath. There are certain heart conditions, such as narrowed arteries in the heart, coronary artery disease, or high blood pressure. They gradually leave the heart too weak or stiff to fill and pump blood properly. Proper treatment can improve the signs and symptoms of heart failure and may help some people live longer. Lifestyle changes, such as losing weight, exercising, reducing salt, sodium, in your diet and managing stress, can improve your quality of life. However, heart failure can be life-threatening. People with heart failure may have severe symptoms, and some may need a heart transplant or a ventricular assist device, VAD. One way to prevent heart failure is to prevent and control conditions that can cause it, such as coronary artery disease, high blood pressure, diabetes and obesity. Symptoms of heart failure. Heart failure can be ongoing, chronic, or it may start suddenly, acute. Heart failure signs and symptoms may include shortness of breath with activity or when lying down, fatigue and weakness, swelling in the legs, ankles and feet, rapid or irregular heartbeat, reduced ability to exercise, persistent cough or wheezing with white or pink blood-tinged mucus, swelling of the belly area, abdomen, very rapid weight gain from fluid buildup, nausea and lack of appetite, difficulty concentrating or decreased alertness, chest pain if heart failure is caused by a heart attack. At first the heart tries to make up for heart failure by 1. Enlarging. The heart stretches to contract more strongly and keep up with the demand to pump more blood. Over time this causes the heart to become enlarged. 2. Developing more muscle mass. The increase in muscle mass occurs because the contracting cells of the heart get bigger. This lets the heart pump more strongly, at least initially. 3. Pumping faster. This helps increase the heart's output. The body also tries to compensate in other ways. 4. The blood vessels narrow to keep blood pressure up, trying to make up for the heart's loss of power. 5. The body diverts blood away from less important tissues and to organs, like the kidneys, the heart and brain. These temporary measures mask the problem of heart failure, but they don't solve it. Heart failure continues and worsens until these compensating processes no longer work. Eventually the heart and body just can't keep up, and the person experiences the fatigue, breathing problems or other symptoms that usually prompt a trip to the doctor. The body's compensation mechanisms help explain why some people may not become aware of their condition until years after their heart begins its decline. It's also a good reason to have a regular checkup with your doctor. Heart failure can involve the heart's left side, right side or both sides. However, it usually affects the left side first. Causes of heart failure. Heart failure often develops after other conditions have damaged or weakened the heart. However, heart failure can also occur if the heart becomes too stiff. In heart failure, the main pumping chambers of the heart, the ventricles, may become stiff and not fill properly between beats. In some people, the heart muscle may become damaged and weakened. The ventricles may stretch to the point that the heart can't pump enough blood through the body. Over time, the heart can no longer keep up with the typical demands placed on it to pump blood to the rest of the body. Your doctor can determine how well your heart is pumping by measuring how much blood is pumped out with each beat, ejection fraction. Ejection fraction is used to help classify heart failure and guide treatment. In a healthy heart, the ejection fraction is 50% or higher, meaning that more than half of the blood that fills the ventricle is pumped out with each beat. But heart failure can occur even with a normal ejection fraction. This happens if the heart muscle becomes stiff from conditions such as high blood pressure. Heart failure can involve the left side, left ventricle, right side, right ventricle, or both sides of your heart. Generally, heart failure begins with the left side, specifically the left ventricle, your heart's main pumping chamber. Any of the following conditions can damage or weaken your heart and can cause heart failure. Some of these can be present without your knowing it. 1. Coronary artery disease and heart attack. Coronary artery disease is the most common form of heart disease and the most common cause of heart failure. The disease results from the buildup of fatty deposits in the arteries, which reduces blood flow and can lead to heart attack. A heart attack occurs suddenly when a coronary artery becomes completely blocked. Damage to your heart muscle from a heart attack may mean that your heart can no longer pump as well as it should. 2. High blood pressure. If your blood pressure is high, your heart has to work harder than it should to circulate blood throughout your body. Over time, this extra exertion can make your heart muscle too stiff or too weak to properly pump blood. 3. Faulty heart valves. The valves of the heart keep blood flowing in the proper direction. A damaged valve, due to a heart defect, coronary artery disease or heart infection, forces the heart to work harder, which can weaken it over time. 4. Damage to the heart muscle. Heart muscle damage can have many causes. They include certain diseases, infection, heavy alcohol use, and the toxic effect of drugs, such as cocaine or some drugs used for chemotherapy. Genetic factors also can play a role. 5. Inflammation of the heart muscle, myocarditis. Myocarditis is most commonly caused by a virus, including the COVID-19 virus, and can lead to left-sided heart failure. 6. A heart problem that you're born with, congenital heart defect. If your heart and its chambers or valves haven't formed correctly, the healthy parts of your heart have to work harder to pump blood, which may lead to heart failure. Arrhythmia. 7. Abnormal heart rhythms. Arrhythmias. Abnormal heart rhythms may cause your heart to beat too fast, creating extra work for your heart. A slow heartbeat also may lead to heart failure. 8. Other diseases. Long-term diseases, such as diabetes, HIV, an overactive or underactive thyroid. 9. Or a buildup of iron or protein, also may contribute to chronic heart failure. Causes of sudden, acute, heart failure also include allergic reactions, any illness that affects the whole body, blood clots in the lungs, severe infections, use of certain medications, viruses that attack the heart muscle. What are the types of heart failure? There are many causes of heart failure, but the condition is generally broken down into these types. Left-sided heart failure. Heart failure with reduced left ventricular function, HF-ref. The lower left chamber of your heart, left ventricle, gets bigger and cannot squeeze, contract, hard enough to pump the right amount of oxygen-rich blood to the rest of your body. Heart failure with preserved left ventricular function, HF-pef. Your heart contracts and pumps normally, but the bottom chambers of your heart, ventricles, are thicker and stiffer than normal. Because of this, your ventricles can't relax properly and fill up all the way. Because there's less blood in your ventricles, your heart pumps out less blood to the rest of your body when it contracts. Right-sided heart failure. Heart failure can also affect the right side of your heart. Left-sided heart failure is the most common cause of this. Other causes include certain lung problems and issues in other organs. What is congestive heart failure? This is a state in which your heart hasn't been able to handle the blood volume. This causes an accumulation in other parts of your body, most commonly in your lungs and lower extremities, feet/legs. What are the complications of heart failure? Some of the complications from heart failure include irregular heartbeat, sudden cardiac arrest, heart valve problems, a collection of fluid in your lungs, pulmonary hypertension, kidney damage, liver damage, malnutrition. What are the heart failure stages? Heart failure is a chronic condition that gets worse with time. There are 4 heart failure stages: Stage A, B, C and D. The stages range from high risk of developing heart failure to advanced heart failure. Stage A of heart failure. Stage A is considered pre-heart failure. It means you're at high risk of developing heart failure because you have a family history of heart failure or you have one or more of these medical conditions: hypertension, diabetes, coronary artery disease, metabolic syndrome, history of alcohol abuse, history of rheumatic fever, family history of cardiomyopathy, history of taking drugs that can damage your heart muscle, such as some cancer drugs. Stage B of heart failure. Stage B is considered pre-heart failure. It means your doctor has given you a diagnosis of systolic left ventricular dysfunction but you've never had symptoms of heart failure. Most people with stage B heart failure have an echocardiogram, echo, that shows an ejection fraction, F, of 40% or less. This category includes people who have heart failure and reduced F, HF or F, due to any cause. Stage C of heart failure. People with stage C heart failure have a heart failure diagnosis and currently have or previously had signs and symptoms of the condition. There are many possible symptoms of heart failure. The most common are shortness of breath, feeling tired, fatigue, less able to exercise, weak legs, waking up to urinate, swollen feet, ankles, lower legs and abdomen, edema. Stage D and reduced F. People who have stage D HFrEF have advanced symptoms that don't get better with treatment. This is the final stage of heart failure. How is heart failure diagnosed? 1. Your doctor will ask you many questions about your symptoms and medical history. You'll be asked about any conditions you have that may cause heart failure, such as coronary artery disease, angina, diabetes, heart valve disease, and high blood pressure. You'll be asked if you smoke, take drugs, drink alcohol, and how much you drink, and about what drugs you take. You'll also get a complete physical exam. Your doctor will listen to your heart and look for signs of heart failure as well as other illnesses that may have caused your heart muscle to weaken or stiffen. Your doctor may also order other tests to determine the cause and severity of your heart failure. These include 2. Blood tests. Blood tests are used to evaluate kidney and thyroid function as well as to check cholesterol levels and the presence of anemia. Anemia is a blood condition that happens when there is not enough hemoglobin, the substance in red blood cells that enables the blood to transport oxygen through the body, in your blood. 3. B-type natriuretic peptide, BNP, blood test. BNP is a substance secreted from the heart in response to changes in blood pressure that happen when heart failure develops or worsens. BNP blood levels increase when heart failure symptoms worsen, and decrease when the heart failure condition is stable. The BNP level in a person with heart failure, even someone whose condition is stable, may be higher than in a person with normal heart function. BNP levels do not necessarily correlate with the severity of heart failure. 4. Chest X-ray. A chest X-ray shows the size of your heart and whether there is fluid buildup around the heart and lungs. 5. Echocardiogram. This test is an ultrasound which shows the heart's movement, structure, and function. Ejection fraction, F, is used to measure how well your heart pumps with each beat to determine if systolic dysfunction or heart failure with preserved left ventricular function is present. Your doctor can discuss which condition you have. 6. Electrocardiogram, EKG or ECG. An EKG records the electrical impulses traveling through the heart. 7. Cardiac catheterization. This invasive procedure helps determine whether coronary artery disease is a cause of congestive heart failure. 8. Stress test. Non-invasive stress tests provide information about the likelihood of coronary artery disease. Other tests may be ordered, depending on your condition. Is there a treatment for heart failure? There are more treatment options available for heart failure than ever before. Tight control over your medications and lifestyle, coupled with careful monitoring, are the first steps. As the condition progresses, doctors specializing in the treatment of heart failure can offer more advanced treatment options. The goals of treating heart failure are to try to keep it from getting worse, lowering the risk of death and the need for hospitalization, to ease symptoms, and to improve quality of life. Some common types of medicines used to treat it are 1. ACE inhibitors, angiotensin-converting enzyme inhibitors. 2. Aldosterone antagonists. 3. ARBs, angiotensin II receptor blockers. 4. ARNIs, angiotensin receptor neprilysin inhibitors. 5. Beta blockers. 6. Blood vessel dilators. 7. Digoxin. 8. Calcium channel blockers. 9. Diuretics. 10. Heart pump medications. 11. Potassium or magnesium. 12. Selective sinus node inhibitors. 13. Soluble guanylate cyclase, SGC, stimulator. Your doctor may also recommend a program called cardiac rehabilitation to help you exercise safely and keep up a heart-healthy lifestyle. It usually includes workouts that are designed just for you, education, and tips to lower your chance of heart trouble, like quitting smoking or changing your diet. Cardiac rehab also offers emotional support. You can meet people like you who can help you stay on track. How is heart failure treated? Your treatment will depend on the type of heart failure you have and, in part, what caused it. Medications and lifestyle behaviors are part of every treatment plan. Your doctor will talk to you about the best treatment plan for you. Treatment is the same, regardless of gender. As heart failure gets worse, your heart muscle pumps less blood to your organs, and you move toward the next stage of heart failure. You can't move backward through the heart failure stages. The goal of treatment is to keep you from moving forward through the stages or to slow down the progression of your heart failure. Stage of treatment. The usual treatment plan for people with stage A heart failure includes regular exercise, being active, walking every day, stopping the use of tobacco products, treatment for high blood pressure, medication, low sodium diet, active lifestyle, treatment for high cholesterol, not drinking alcohol or using recreational drugs, angiotensin-converting enzyme inhibitor, ACE-I, or an angiotensin II receptor blocker, ARB. If you have coronary artery disease, diabetes, high blood pressure, or other vascular or cardiac conditions. Beta blocker if you have high blood pressure. Stage B treatment. The usual treatment plan for people with stage B heart failure includes treatments listed in stage A. Angiotensin-converting enzyme inhibitor, ACE-I, or angiotensin II receptor blocker, ARB, if you aren't already taking one. Beta blocker if you've had a heart attack and your F is 40% or lower, if you aren't already taking one. Aldosterone antagonist if you've had a heart attack or if you have diabetes and an F of 35% or less. Possible surgery or intervention as a treatment for coronary artery blockage, heart attack, valve disease, valve repair or replacement, or congenital heart disease. Stage C treatment. The usual treatment plan for people with stage C HFrEF includes treatments listed in stages A and B. Beta blocker, aldosterone antagonist if a vasodilator medicine, ACE-I, ARB or angiotensin receptor/neprilysin inhibitor combination, and beta blocker don't relieve your symptoms. Hydralazine/nitrate combination if other treatments don't stop your symptoms. Patients who are Black should take this medication, even if they're taking other vasodilator medications, if they have moderate to severe symptoms. Medications that slow your heart rate if your heart rate is faster than 70 beats per minute and you still have symptoms. A diuretic, water pill, may be prescribed if symptoms continue. Restriction of sodium, salt, in your diet. Tracking your weight every day. Tell your healthcare provider if you gain or lose more than 4 pounds. Possible fluid restriction. Possible cardiac resynchronization therapy, biventricular pacemaker. Possible implantable cardiac defibrillator, LCD, therapy. If the treatment causes your symptoms to get better or stop, you still need to continue treatment to slow the progression to stage D. Stage D treatment. The usual treatment plan for people who have stage D heart failure includes treatments listed in stages A, B and C. In addition, it includes evaluation for more advanced treatment options, including heart transplant, ventricular assist devices, heart surgery, continuous infusion of intravenous inotropic drugs, palliative or hospice care, research therapies. Stages C and D with preserved F. Treatment for people with stage C and stage D heart failure and preserved F, HFpEF, includes treatments listed in stages A and B, although some may not be appropriate. Medications for the treatment of medical conditions that can cause heart failure or make the condition worse, such as atrial fibrillation, high blood pressure, diabetes, obesity, coronary artery disease, chronic lung disease, high cholesterol and kidney disease. Diuretic, water pill, to reduce or relieve symptoms. It's very important for you to manage your other health conditions, such as diabetes, kidney disease, anemia, high blood pressure, thyroid disease, asthma, chronic lung disease. Some conditions have signs and symptoms similar to heart failure. If you have new or worsening non-urgent symptoms, tell your doctor. How can I prevent heart failure from getting worse? Keep your blood pressure low. In heart failure, the release of hormones causes the blood vessels to constrict or tighten. The heart must work hard to pump blood through the constricted vessels. It's important to keep your blood pressure controlled so that your heart can pump more effectively without extra stress. Monitor your own symptoms. Check for changes in your fluid status by weighing yourself daily and checking for swelling. Call your doctor if you have unexplained weight gain, 3 pounds in one day or 5 pounds in 1 week, or if you have increased swelling. Maintain fluid balance. Your doctor may ask you to keep a record of the amount of fluids you drink or eat and how often you go to the bathroom. Remember, the more fluid you carry in your blood vessels, the harder your heart must work to pump excess fluid through your body. Limiting your fluid intake to less than 2 liters per day will help decrease the workload of your heart and prevent symptoms from coming back. Limit how much salt, sodium, you eat. Sodium is found naturally in many foods we eat. It's also added for flavoring or to make food last longer. If you follow a low-sodium diet, you should have less fluid retention, less swelling, and breathe easier. Monitor your weight and lose weight if needed. Learn what your dry or ideal weight is. Dry weight is your weight without extra water, fluid. Your goal is to keep your weight within 4 pounds of your dry weight. Weigh yourself at the same time each day, preferably in the morning, in similar clothing, after urinating but before eating, and on the same scale. Record your weight in a diary or calendar. If you gain 3 pounds in 1 day or 5 pounds in 1 week, call your doctor. Your doctor may want to adjust your medications. Medications are used to improve your heart's ability to pump blood, decrease stress on your heart, decrease the progression of heart failure, and prevent fluid retention. Many heart failure drugs are used to decrease the release of harmful hormones. These drugs will cause your blood vessels to dilate or relax, thereby lowering your blood pressure. How can I prevent further heart damage? In an effort to prevent further heart damage, stop smoking or chewing tobacco. Reach and maintain your healthy weight. Control high blood pressure, cholesterol levels, and diabetes. Exercise regularly. Don't drink alcohol. Have surgery or other procedures to treat